you want to? Am I recording? I don't know. I lost my recorder.
Oh, okay.
So is this okay?
As long as I don't have to look at myself.
It's okay. Okay.
That's gonna make me really self-conscious.
Well, we'll just turn it down. Right. I don't have to look at
Is
it.
the microphone in the front though? So
I don't know.
I can deal with it. Don't worry about it.
It's
Just aim it towards the light.
okay. Yeah, so she don't have to see it. Okay.
Okay. Go ahead. Can I see your questions?
Yeah. Okay. So, can you state your name and where'd you go to undergrad, get your doctorate, your master's, all that?
Okay. My name is Sarah Michelson. I completed my undergrad in Denmark. I grew up in Denmark. And then I came here for grad school and I completed my master's and doctorate here at Roosevelt.
Okay. So.
Those same questions.
Oh, okay. We did.
Yeah.
So, can you give us why you chose to get your doctorate in clinical psychology?
Just generally, or as opposed to something else?
Let's go generally and go in depth in what you want to do. Like, just tell us everything.
I've always wanted to be a psychologist. I like that there are so many different things you can do rather than just one thing.
Okay.
So there's a lot of flexibility in the career, a lot of different opportunities. I chose, clinical psychology is kind of broad, so I guess that's why I chose clinical versus counseling or something like that.
Okay. Okay. So what is your job role and your function? So you teach, I know that, well, we know that, so tell us everything you do.
So I teach, and then I work in a private practice doing therapy. I do primarily cognitive behavioral therapy with adults. I don't see children.
Okay.
And then I work for the Chicago Police Department, conducting fitness for duty evaluations.
So is that like, I guess that would be like to see if they're fit to be a police officer?
Yes.
Okay.
As you know, they're hiring a lot of new people.
Really?
Yeah.
Okay. Yeah, we just moved here, so.
Okay. Okay.
Okay. So I guess what's your theoretical orientation? So.
That would be cognitive behavioral.
Cognitive behavioral. Yeah. Okay. I don't know if this is too uncomfortable, but what was your entry level salary and options for investment? Like, so what was your entry level salary when you started?
I work part time, so I can't tell you like a yearly salary. I guess entry level would be internship, where what was that, 25,000, and then postdoc I think it went up to 40, and then once you get your license it increases. But then I worked part time, so it's been hourly, so I couldn't tell you what it would be yearly. Okay. Generally, you don't do it for the money.
Yeah, I know. I mean, long as we can live comfortably, like I feel like that's what everybody's been saying. Like, long as I'm comfortable, like, that's fine. I know we're not gonna be rich off of this, like, unless I hit the lottery. So, okay. So, what are some of the related likes and dislikes of the present positions and some of your past positions as a clinical psychologist?
I'm gonna think. I already stated I like the variety and the flexibility. I like doing different things. I really enjoy doing therapy. Helping someone to change, I think, can be a very profound experience.
Okay.
Sometimes people are very resistant to therapy, and that can be very frustrating. It can be frustrating when you see someone with a lot of problems, and for whatever reason, they're not really engaging, and bad things happen, and that can be frustrating.
Okay.
And working with trauma, there's some level of vicarious trauma that you just take home with you, which can be hard as well.
So, like, how do you cope with the trauma issue? Like, some of the stuff that you take home. Like, how do you separate the two where it doesn't interact in your life so much? Like, where you're constantly thinking about what someone told you in therapy last week.
I think you really have to compartmentalize.
Okay.
And I think you have to have a healthy support system in place, whether family, friends, exercise, whatever works for you. But you have to be very careful not to take it home with you, because then you're always at work.
Okay, so what professional associations do you belong to?
I belong to the New York State Psychological Association, because I just lived in New York, and I used to belong to the American Psychological Association. I don't any longer.
Okay. Okay, you go.
so when you're applying for your doctorate degree, what sets you apart from other candidates? Because I know that this is apparently one of the doctor and clinical psychology is one of the hardest or most competitive to get into.
Yeah, it's ridiculously competitive.
So what sets you apart?
I think knowing why you want to be a psychologist. I think if you go in and you say, I want to be a psychologist because I want to help people, you can help people in a variety of different ways. I think that needs to be clear in your mind why you want to be a psychologist and having knowledge of what a psychologist does. And I think having a background in psychology, whether it's volunteering or actually having some kind of therapeutic interaction, would help you. Having, depending on what type of programs you apply for, having knowledge and experience with research would definitely help you. Volunteering at a research lab or whatever that may be.
So you had a lot of experience with volunteering in different jobs and stuff. I mean, different on-the-job training type things.
I did, and I continue to do that while I attended grad school. I volunteered. Well, no one pays to do anything when you're in grad school. But additionally to what I had to do, I also, if I had to do one externship, I did two. I tried to really get as much experience as I could. Okay. And I also volunteered as a research assistant for various different things.
Okay. So you recommend, we have a requirement to do 5 hours a week. So you recommend doing it with 2 different sites and possibly 2 different populations?
Not necessarily. I think it depends on what you want to do. I recommend getting as much experience as you can. Okay. Reaching out, finding people. If do you know what you want to work with?
Not really.
Okay. But if you have an idea, then look up people who work with that, and I think people are generally always willing to take on people who are motivated and willing to learn.
Okay. Well, I'm working with the Jewish Family Center.
Yeah.
That is at-risk teenagers with social issues, and so that's very interesting. And then I want to do something with people with schizophrenia, and so I just don't know where to look here yet. So that's the thing. Do you have any other?
There would probably be a lot of I imagine a lot of homeless shelters. A lot of the people you see, homeless people in Chicago, have serious mental illness, because I think if you're more capable, you probably wouldn't choose to be homeless in Chicago. It's the worst climate for that. So a lot of them have psychotic disorders, schizophrenia. Okay. So I would really recommend looking into that.
What do you consider the most important factor in developing your professional career, turning you into who you are today? But what do you think was the biggest deciding factor, helping you get where you wanted to be?
I think being goal oriented, knowing what you want and working towards that goal in sort of coherent way. Some people don't really know, and they do 10 different things. I think the more focused you are, the better. I haven't always done a great job of that, but that would be my advice, to be as focused as possible. Aligning yourself with the right people, people who want to mentor you and help you. I think that could be a tremendous asset, and I've been lucky now. I've worked with people who were willing to teach me.
Okay. So did you finish your master's here, or did you just bridge into the PsyD program?
What did I do? I think I started in the master's program, and then I applied to the PsyD program during my first year in the master's program, and I was accepted.
Okay.
So I never got, a terminal master's degree.
Okay. So how easy was that to do? Because in words of credit hours, did they take everything, or?
Yeah, it was the same. The first year, I don't know how it is now, but the first year it was exactly the same.
Okay.
For the doctoral and the.
Okay.
So yeah, it was only. It was a semester and a half, so I guess 2 semesters. Mm-hmm. So yeah, it was all the same.
Okay.
Yeah, I think.
So would you recommend to other people to go from a master's directly into a doctorate without finishing the master's?
I don't think it really mattered to me, because it was the same curriculum.
Okay.
I think it depends what you want to do. If you know you want to work with, anger and aggression, and you want to work with that and do research with that, you would probably want to find a program where there's someone who works with that.
Yeah.
So I think aligning yourself with the right people, depending. I don't know. Do you both want to do doctorates or?
Yeah, PsyDs, yeah. Like we had a talk with some people from the military last week, and I'm like highly interested in the PTSD. So like he was saying that I don't want to join, which I think was the most goal for them to get us to join because they have like such a need in their population. Like they said they're begging people. Yeah. But he said like you get state of the art training in like Washington State if you go to PST if you're gonna be specialized in PTSD. Yeah. So I'm thinking about that, but I don't want to try.
You would have to like enlist.
Well, he said you have to enlist, and they have a couple spots for civilians. Yeah. But they highly recommend you. I don't want to do that. Like.
No.
Yeah, I think you. I mean, that's just my personal opinion. You probably only want to do that if you want like a career in the military.
Right. So.
I mean, if you want to work with PTSD, there are other ways of doing it.
Yeah. We just need like I think with us is that we're kind of confused about stuff like so far for me stuff has been kind of like vague. Has it been like that?
What?
Like just I don't know. I guess because we don't have like mentors telling us like step by step like what we need to do to get to where the goal is.
Yeah.
So like I don't know like I guess we just have to keep asking questions like.
But I guess my question would also be why do you want a doctorate versus a master's degree? I mean, if your goal is to do therapy, and again, this is just my personal opinion, I don't know that you need a doctorate to do that.
Okay.
Because there are so many, I think in Illinois was it LCPC, and social workers who do therapy, and people generally prefer to hire them because they're cheaper.
Oh.
So I think if you want to do therapy, you could have a great career.
Okay.
With an MA or an MSW if you want to be a social worker. I think if you want to do assessment, evaluation, research, then you definitely want a doctorate.
Okay.
But especially if you go to PsyD and you actually pay for it, it gets very expensive.
Okay.
Where do you see the growth of clinical psychology going? I mean, where do you see the need growing? Or do you see any in a certain field or specialty?
I mean, I guess that kind of relates to what I just said. I think that's a serious issue in the field that I think psychologists have kind of marginalized themselves in a way. And what is the role of a psychologist? What can a psychologist do that a social worker can't do? And psychologists have a hard time answering that question other than, we're more, we're trained, we have more training, and that's true, but does it really make a difference if you have 2 years of training or 5 years of training? Does it make a difference in terms of outcomes? And I think psychologists have had a hard time defining that therapy has better outcome with a psychologist versus a social worker. I think, you spoke of the military. I think that's definitely an area of growth in terms of returning soldiers. I work with veterans in the VA, and it's definitely an issue. Again, I think assessment, forensic assessment, those are all areas of growth, and I think a lot of psychologists have had to sort of carve out different areas of specialty for themselves just to compete with master's level practitioners.
Do you have any more questions?
No, not really.
Well, thank you, Dr. Michelson.
I think to answer your last question, I think some kind of I think a lot of people have branched out into using like Skype and like teletherapy, and I think that's a real area of growth.
Which eye therapy?
I'm sorry, what?
Like eye therapy, because we just had a discussion about that in class last week, and she asked us did we think that was ethical or was that appropriate. So people are doing that a lot, really?
Yeah, I haven't done it myself, but yeah, people do it via Skype or phone. I mean, a lot of people. It's kind of inconvenient, you have to go somewhere, and see someone.
Right.
And you can reach a lot of people, especially in rural areas, maybe live out in the middle of nowhere, I'm not going to drive, 45 minutes, each way to go see someone.
Right. Okay.
So you can reach a lot of people.
Well, that's interesting.
But I think Skype, you can actually see people. It does offer a lot versus just a phone where a lot can get lost.
Okay. Because that's what we were saying we were uncomfortable with, was not being able to see the person. And say certain things and not see the reaction to their face, and then somebody said, well, Skype is different because you can see them, and I was like, well, that's true, but like if they threaten to jump off, you don't have time to get there and like that's the downside to it. So that's interesting. You got anything else?
I don't think so.
Okay.
Okay.
You're very welcome.
Thank you.